Jai Jinendra. Hello friends, welcome to Wings to Dreams. Myself Khushi Jain from JNU MSRC Jaipur, and in this video I am going to discuss about triangles of neck, anatomy about anterior and posterior triangles of neck. So let's start with the video. Before going to triangles of neck, first we should know about the structures. These structures you are seeing here, what is this? This is the median raphe, this is the hyoid bone. Okay, this is this whole thing. Yeah, this part you must know ki what are this part. This is known as fibrous raphe, this is the hyoid bone, and then this is the thyrohyoid membrane. Adam's apple, it is more increased in size during the age of puberty in males as compared to females. And this is the Crico thyroid ligament, this is the thymus of thyroid. Okay, and this is the pyramidal lobe of the thyroid, you can see here, and this is your jugular venous arch. So this all are the things which you must know before going to ट्रायंगल्स ऑफ नेक, क्योंकि ये सारी चीज़ें आपका बेसिक बनाएगी. सो यू मस्ट लर्न कि ये जो स्ट्रक्चर्स हैं, ये दिस स्ट्रक्चर्स आर मोर इम्पॉर्टेंट फॉर द सेक्शनिंग ऑफ नेक आल्सो. If you are doing cricothyrotomy or any neck surgery, okay, so then these all landmarks are most important. Okay, after that let's come to the hyoid bone and muscles. So here this is the hyoid bone, okay, and the muscles which are present above the hyoid are known as suprahyoid muscles, and the muscles which are present below the hyoid bone are known as intrahyoid muscles. So what are the groups of the intrahyoid muscles? Intrahyoid muscle contains sternohyoid, sternothyroid, thyrohyoid and omohyoid. Okay, so you can see here, as name suggests, first one is sternothyroid. This is the thyroid gland, okay, and the muscle coming from thyroid gland to the sternum is known as sternothyroid. Okay, you can see here, this is sternohyoid. Okay, so muscle coming from hyoid bone and reaching towards the sternum, this is known as for its attachment, it is known as sternohyoid muscle. This is the superior belly of omohyoid and tendon, and then again this is the inferior belly of omohyoid. This is the posteriorly inferior belly attached to the superior border of scapula. Okay, this is a normal arrangement where we are going to discuss all the triangles of neck. So you must know all this structure. Okay, so this is thyrohyoid, this is a small muscle, you can see till what from coming from hyoid bone to the thyroid gland. This is the thyrohyoid muscle. Sternothyroid is from hyoid bone, starting from thyroid gland and attaching to the sternum. So this is known as sternothyroid. These are the oblique fibers of the thyroid cartilage, the clavicle and first part cartilage, and this part is known as manubrium sterni. Okay, now coming to the next part. Yeah, this is the most important diagram. You can post the video and also make this diagram for your convenience. Okay, let's first understand this diagram. What is it? This is the main thing which is very important for remembering all the triangles of the neck. You can see here, this is the angle of mandible, this is the mastoid process. Okay, after that we have anterior triangles and posterior triangle. For the group of the anterior triangles of the neck, anterior triangles are further divided into four, that is digestive triangle, carotid triangle, submental triangle and muscular triangle. And posterior triangles are divided as two, occipital and subclavian triangle. So for learning this, let's start. This is the clavicle. Okay, this is the anterior end, that known as manubrium attached to the sternum. This is your mandible and this is mastoid process. The posterior to the mastoid process, this muscle you are seeing is known as trapezius. Okay, and this the long muscle which is present in your neck side, it is sternocleidomastoid. When you all turn your head like this, you can easily see here in the neck the muscle that is sternocleidomastoid. Okay, so this muscle is the main which makes the boundary of anterior and posterior triangle. Now coming to the posterior triangle first. Okay, so this is the superior belly of omohyoid and this is the inferior belly. The inferior belly of the omohyoid forms the posterior triangle. This triangle you are seeing here, this is the posterior triangle of the neck, joining and this inferior belly of omohyoid divides this posterior triangle into two parts, occipital and subclavian triangle. Okay, and in case of the anterior triangle, you can see here anterior triangle is this whole. Okay, now in anterior triangle there are sub triangles, which are, this is the posterior belly of digastric attaching to the hyoid bone coming from the mastoid process. This is the anterior belly of digastric coming from angle of mandible attaching to the hyoid bone. Okay, so anterior belly of digastric and posterior belly of digastric, both this muscle forming a triangle, you can see here, this is known as digastric triangle. So we can say the boundaries of digastric triangle by looking at this. Anteriorly formed by anterior belly of digastric, posteriorly by posterior belly of digastric, and base is formed by the angle of mandible. Now coming to the second one, this is the carotid triangle. Carotid triangle की boundaries हम कैसे बता सकते हैं? So as you know, this is the posterior belly of digastric, again attaching to the hyoid bone. Posteriorly is what? Sternocleidomastoid muscle, and inferiorly this we can say superior part, and this is inferior part, anterior superior and anterior inferiorly. So anterior inferiorly it is formed by superior belly of omohyoid. So boundaries of carotid triangle are also easy. Anterior superiorly is the posterior belly of digastric, anterior inferiorly is the superior belly of omohyoid, and posteriorly anterior border of the sternocleidomastoid. I hope you all got it. Okay, so next coming to this triangle small, this is the submental triangle. Submental triangle is formed by what? This is anterior belly of digastric and base of the hyoid bone. Okay, so and this is the mental part. So this triangle forming here is known as submental triangle. Next we come to this triangle. This is the muscular triangle that's formed by two muscles here. So what are they? This is the superior belly of omohyoid superiorly, and posteriorly we can say posterior border या lower part of sternocleidomastoid muscle. So this is known as muscular triangle. So this digastric, carotid, submental and muscular, this all forms the anterior triangles of the neck, and this is the posterior triangle. Okay, so this is all about the triangles of the neck. Now let's come to know about each in brief. Okay, so as you know, this is the hyoid bone. Here we can say the triangles, all the triangles of anterior triangles. This is the submental triangle, submandibular triangle, carotid triangle, and the muscular triangle. This all is supplied by submental group of the lymph nodes. Most of the face and its parts are supplied by this only. Okay, and muscles you can see here. This is the anterior belly of digastric. This is the mylohyoid muscle. This is your anterior jugular vein and the again hyoid bone. As I said that submental group of lymph nodes supply most of the your face part, so this part is covered by submental group of the lymph nodes, and this supply is like this. Now coming to the muscles of the triangle, all the muscles you know very well, whatever I discussed, that are infrahyoid muscles. You can see this is from sternum to this is from thyroid gland, coming from thyroid gland going towards the sternum. So this is known as sternothyroid muscle. Next one you can see here, this is coming from the hyoid bone attaching to the thyroid gland. This is thyrohyoid muscle. Next is coming from where thyroid gland and attaching to the sternum, sternothyroid muscle, and this is your thyroid gland. So these all are muscles of the triangles that form the infrahyoid muscles. Okay, then again the floor of the triangle. Floor of the triangle is formed by mylohyoid muscle, hyoglossus muscles, and middle constrictor muscle. This is all about the anterior triangle. Okay, mylohyoid muscle, hyoglossus, and middle constrictor muscles. You can see here how they are attached in a schematic diagram here. So this is your angle base of the mandible. Okay, and here mylohyoid muscles, superior belly and inferior belly of mylohyoid. Here is posterior triangle forming sternocleidomastoid part. So this is the mylohyoid, this is hyoglossus and hyoid bone. So and posteriorly this is middle constrictor. So all these muscles forming the floor of the triangles. Coming to this, here you can very well appreciate styloid process and all the muscles attached to this styloid process. Okay, यहाँ से Now, after knowing about all the muscles, let's know about what are its contents, that what this area is supplied by. If we take out all the muscles, then we look this structure, that what are the arteries and veins and group of the lymph nodes and nerves that are supplied here. So first of all, towards the base of the angle of mandible, this is the facial artery and facial vein. Okay, after posteriorly to posteriorly to it is internal jugular vein and internal carotid artery. This hypoglossal nerve formed here, ansa cervicalis. We will learn it about sooner. So in the next slide, so this is formed by hypoglossal nerve. Anteriorly, it's the submental artery. You know, myeloid nerve and vessels. Myeloid nerve enters into the submental foramen. Okay, and this is the submandibular group of the lymph nodes, as I already discussed. Now you can see and appreciate here also sternocleidomastoid muscle. Again, this is the middle, these are the muscles of the pharynx, middle constrictor and inferior constrictor muscles. This is the posterior belly of digastric hyoglossus. Okay, so you can very well appreciate all here. I don't need to repeat it all again. Internal carotid artery, occipital artery, external carotid artery and all. Now let's come to the second topic, that is the carotid sheet. Okay, so यहाँ जितनी भी structures थी वो आपस में ऐसे ही open नहीं है. They are covered by a sheet known as carotid sheet. And carotid sheet के बारे में what all the things we should know is extent of the carotid sheet, formation of the carotid sheet, what are the contents and structure piercing the carotid sheet, cause it is very important for your clinical purpose as well as for your theory and practical exams. So हर बार कहीं पर भी मतलब ये questions कोई टीचर नहीं छोड़ता. Always it is a commonly asked question. So let's start with this. So this part, you know, it is your carotid sheet and it is formed by these things. Okay, so this is your carotid sheet and this is formed by what are the contents of the carotid sheet. This is the internal jugular vein, vagus nerve and the internal carotid artery. You know, this is a branch where going externally from the carotid sheet is the external carotid artery. Okay, so form common carotid artery, internal external carotid artery. So carotid sheet forms this thing, and when we do it as a transverse section, then it looks like this. So common carotid artery, branch, internal jugular vein and the vagus nerve are the contents of this. Anteriorly to the carotid sheet, ansa cervicalis is present, and posteriorly to it is the prevertebral fascia and sympathetic chain. So all the things are discussed. Extend anteriorly ansa cervicalis up to the prevertebral fascia, posteriorly formation by carotid sheet, fascia covering it, contents internal jugular vein, vagus nerve and carotid artery, structure piercing the sheet as I already told you. So I have discuss the thing that is internal jugular vein. So where this drainage comes from, internal jugular vein के अंदर क्या क्या आता है. So this is you all are seeing here. Wait a minute. Yeah, this is, you know, the venous drainage of your brain. This is the superior sagittal sinus, inferior sagittal sinus. Superior sagittal sinus drain into the transverse sinus, inferior sagittal sinus drains into the straight sinus, and this again some greater cerebral veins also drains into the straight sinus, and this combine to form transverse sinus. This is known as confluence of sinuses, where all sinuses are made, sinus drainage is made, and then this drain into the sigmoid sinus. This from sigmoid sinus and from superior and inferior petrosal veins drains into the internal jugular vein, and this forms whole of the supply of the internal jugular vein. Okay, then which it goes to the heart. So this you can see the superior bulb of the internal jugular vein and inferior bulb. You know, this is here after taking all the venous drainage from the brain, and from this is the superior bulb of the internal jugular vein, inferior bulb of the internal jugular vein, and what else, the facial vein. Okay, so other branches are superior thyroid artery, lingual, pharyngeal branches. ये सारी branches जो हैं facial vein, ठीक है, ये सारी की सारी जो branches हैं वो सब internal jugular vein के अंदर drain करती हैं. After that, so here internal jugular vein, superior thyroid, lingual, common, facial, pharyngeal and occipital. Now next, this is the ansa cervicalis, whatever I am talking about, and I know you all are very well oriented to this diagram also, because it has come many times in our exams and given in our anatomy book BDC, that is BD Chorasi also. So most commonly asked in your exam, so I just request you at once, if you are watching this video, then please learn this diagram. Okay, so first let me explain you that this is what the hypoglossal nerve, and this is your ansa cervicalis. This loop you are seeing is known as ansa cervicalis. What is this? Ansa cervicalis is a very thin loop, okay, formed by branches. It has a superior root and inferior root. Superior root is going upwards, so it is known as descendens hypoglossi. Inferior root is going downwards, so it is known as descending cervicalis. Okay, so superior root, which is also known as descendens hypoglossi, it supplies the one muscle, that is superior belly of omohyoid. Okay, and inferior root, it supplies inferior belly of omohyoid, sternohyoid and sternothyroid. So you must remember this thing: inferior root descending cervicalis supply inferior belly of omohyoid, sternohyoid and sternothyroid. Superior root supplies superior belly of omohyoid, and nerve to gynohyoid, nerve to thyroid may also be supplied. And if this goes upwards, then C2 and C3 branches of ventral rami of spinal nerves are supplied by this, and meningeal branch comes from C1, is also the part of this. So mostly this loop is known as ansa cervicalis, and this is all about the supply, where and in which muscles it gives the supply and branches to different nerves. Now coming to the posterior triangle of the neck. Posterior triangle of the neck, as I told you, is formed by what? It formed by sternocleidomastoid anteriorly, posteriorly trapezius muscle, and inferior belly of omohyoid. This is the superior belly and this is the inferior belly. Then this inferior belly of omohyoid divides this triangle into two parts, occipital and submental triangle. Okay, so suboccipital triangle. So this is the posterior triangle. Now what are its roof formed by? So skin, then superficial fascia covered with platysma, that is neck muscle only, and investing layer of the deep fascia, deep cervical fascia. This all forms the roof of the anterior triangle. Structure piercing the roof. What are the structures? External jugular vein, supraclavicular nerves, small cutaneous arteries and the lymphatic vessels. Okay, skin, superficial fascia, investing layer of deep cervical fascia forming the roof of the posterior triangle. What are the structures that are piercing the roof? These are external jugular vein, supraclavicular nerves, small cutaneous arteries and lymphatic vessels. Now as I told you, occipital triangle and I was wrong there, that is subclavian or supraclavicular triangle. So upper part is formed by occipital and the lower part is formed by subclavian triangle. Now floor of the triangle, fascia covering by the prevertebral fascia. What forms the floor of the triangle? So prevertebral fascia को जो भी fascia cover कर रहा है, that, and also there are four muscles which forms the floor of the posterior triangle, that are splenius capitis, levator scapulae, scalenus medius and posterior, and first digitation of serratus anterior. Okay, just you can remember by this S square L1, like splenius capitis, scalenus medius and posterior, levator scapula and first digitation of serratus anterior. So you can see here, this is the semispinalis capitatis, this is splenius capitis, this is levator scapula and scalenus medius, forming the floor of the posterior triangle from the superior knuckle line. Okay, so this is all about the part which forming the floor of the triangle. Now coming to the nerves which are going from this triangle, posterior triangle, that are greater auricular nerve, transverse cervical nerve, external jugular vein, internal jugular vein is going from anterior triangle, lesser occipital nerve and roof. Okay, so as I already told you, roof is formed by the fascia, floor we have discussed from these muscles, and nerves which are supplying here are greater auricular, lesser occipital, transverse cervical and external jugular, and group of C3 and C4 supraclavicular nerves. So you can now very well know this diagram and tell me what are the structures here. Okay, so this is your hyoid bone. So this is probably the submandibular gland, internal jugular vein, internal carotid artery, and these are the bunch of nerves, occipital nerves. This is Okay, so all this structure again it's the same thing about the lymph nodes, all the nerves which are supplying here. Okay, this is the diagram showing both the occipital and the subclavian triangle of the posterior triangle part. So this is all about the triangles, its parts. I hope you all got it very well. Okay, if you have any doubt then you can ask me in comments. So please do like, share and subscribe for more. And दिस इज़ ऑल अबाउट द एंटीरियर ट्रायंगल. अगर आपने अभी तक मेरे चैनल को सब्सक्राइब नहीं किया है तो प्लीज़ जल्दी से टैप द बेल आइकन एंड सब्सक्राइब टू माय चैनल, ताकि आप सभी को मेरे चैनल के और भी अच्छे से वीडियोस जो हैं एनाटमी, फिजियोलॉजी, बायोकेमिस्ट्री से लेकर के फर्स्ट टू फाइनल ईयर वॉट एवर आई डिड इन माई जर्नी आप सभी को मिल सके, उनके नोटिफिकेशंस आप तक पहुंच सके. धन्यवाद एक बार और फिर से, क्योंकि आपके ही सहयोग से हमारा उत्साह निरंतर बढ़ता रहेगा. धन्यवाद.